we're excited to tell you a little bit about our new research on advancing clinical knowledge on atopic dermatitis and xerosis in diverse patients, and also the role of prebiotic skincare in managing those two skin conditions. So for context, atopic dermatitis shows higher prevalence in skin of color populations versus white counterparts. More and more studies demonstrate that atopic dermatitis, including xerosis, not only shows higher prevalence, but also shows worse quality of life. Despite experiencing higher incidence, skin of color populations are still underrepresented in atopic dermatology clinical trials, which really leads to this disease being understudied in people of color, but also misdiagnosed or undercounted in patients of color due to the different clinical presentations of the disease. So overall, we were able to identify is that within our study conditions, we were able to include 140 subjects, half presented with mild atopic dermatitis and the other half presented with severe xerosis. But we also saw nuances in the impact or the improvement on quality of life, such as xerosis white patients presented with worse quality of life with the disease compared to their skin color counterparts, but show improvement over time. The other nuances that we saw within our study is that atopic dermatitis patients of color show higher or experience greater itching sensation compared to their white counterparts. And that was interesting to see because this was inconsistent with prior literature. The last piece of data that we're able to find is that after we collected skin samples by tape stripping, we were able to identify that patients of color presenting with both xerosis or atopic dermatitis show lower levels of natural moisturizing factors in their skin compared to their white counterparts. And these results are very interesting because it may provide another possible explanation why patients of color are most susceptible to atopic dermatitis and xerosis.